Hello and welcome to Health Matters. My name is Dr. Michael Chillemi, and on today's episode, this is number 3 in my series on the knee. We're going to talk about inflammatory and degenerative conditions and everything else that's in there. So far, what we've covered in the series is the full anatomy of the knee with all the information you need to know about the full anatomy. So you have a complete understanding of the knee. I also took you through knee injuries, whether it's ACL, MCL, PCL, and everything else in between. Now we're at the point of going over inflammatory and degenerative knee conditions. So welcome back. In this episode, we're going to say health in focus. Again, I'm your host, Dr. Michael Chillemi, and we are going to dive into the intricacies of inflammatory and degenerative and anything else under the sun for the knee. So the knee is a very complex joint, and understanding the different types of ailments and symptoms, causes, and treatment options can help you manage and prevent long-term damage. So without further ado, let's get started. Arthritis. We're going to talk about this first. It's a chronic condition affecting millions and millions of people all over the world, particularly older adults and arthritis. As a side note, I have a full episode on arthritis, on osteoarthritis. So this is going to give you a little synopsis, but if you want the full version, I'm going to have you go back and watch one of my previous videos. The same thing is going to apply to rheumatoid arthritis and gout. Those are the next two coming up. I have full episodes and I break them down in complete detail, in intricate detail, actually, each one of those. So I will give you a synopsis here, but if you want to take a deep dive into them, please watch one of my previous videos. Okay, so osteoarthritis. It's a degenerative joint disease characterized by the breakdown of cartilage, which is the firm, slippery tissue that covers the end of the bones, where the bones form a joint, right? So where the bones form a joint, so the spaces in between the cartilage. Over time, this condition can lead to pain, swelling, decreased ranges of motion, and joint stiffness. Osteoarthritis is the most common condition for arthritis, and it affects the weight-bearing joints, such as the knee, hips, and spine, but it can also affect the hands as well. What causes it? The causes are primarily wear and tear of the joint, but several factors can contribute to its development. Age, so the older we get, the more we're at a risk for osteoarthritis, joint injuries, sports injuries, accidents, repetitive stresses. They all can increase your risk for osteoarthritis. Mechanical stresses, like your occupation or activities. When you do things constantly over and over again, like for example, if you're working in a warehouse and you have hard cement floors and you're doing that for 30 years, the wear and tear can definitely affect your joints. Obesity, when we're excessively heavy and the weight adds to our body stresses, and especially those weight-bearing joints, especially your knees and hips. Make a very big difference. Genetics. There's definitely a family history of osteoarthritis can increase when you have other members of your family that have it. Other diseases such as diabetes, rheumatoid arthritis, and certain metabolic diseases can contribute to osteoarthritis. Now, the symptoms of osteoarthritis can vary among individuals, but they typically include joint pain, especially in the morning or after movement, tenderness. The joints may feel tender when slightly under pressure, when slightly push on them. Stiffness, particularly noticed after periods of inactivity. or first thing in the morning. So you wake up from sleep or you get off the couch, you can definitely feel it. Loss of flexibility. So you're going to have a decreased ranges of motion in the affected joints. Grating sensation, a feeling of grating or grinding when using the joint. You can hear it. Doesn't sound so good. Bone spurs, extra bits of bone which feel like hard lumps could form around your joints. Okay, how do we diagnose it? Good medical history, good physical examination, right? We're going to evaluate the symptoms, we're going to evaluate the history, and typically in that history, there's going to be some joint tenderness, swollen, decreased motion. We're going to then want to take some x-rays. X-rays can reveal cartilage loss, bone damage, bone spurs. You can also do an MRI for more detailed imaging in the surrounding areas of the joint. Blood tests. There's no specific blood test for osteoarthritis, but blood tests can help rule out other conditions. So if you have two different conditions and you want to rule them out, if the other condition had an associated blood type finding, then that would rule that out. You could also do a joint fluid analysis to identify inflammation and rule out other arthritic type conditions, such as rheumatoid arthritis or gout. Treatment. While there's no cure for osteoarthritis, treatment can manage symptoms and improve function. Treatment can play a very big role in a patient's life. So the combination of medication, physical therapy, and there at times surgical interventions. Typical medical interventions could be acetaminophen for pain, NSAIDs for decreasing the inflammation. You could even use topical NSAIDs applied directly onto the skin. Corticosteroids, they're typically used to reduce pain and inflammation, but there are side effects with corticosteroids. I'll mention it briefly here. Corticosteroids, while they're very, very good at taking away pain and inflammation, their method of doing that is stopping blood flow from around the area. When you stop blood flow from around that area, what's going to happen? That area is going to dry out. When that area dries out, now imagine this: you have a joint here. It's meant to be smooth. You stop the fluid in there. You slow it down. It becomes dry. That area, just take anything you want to take, make it drier. It's not going to be as smooth. It's going to be rough. When things start to become rough, they start to irritate, swell up, break up over time. So you end up spiking your arthritis over time. Well, the corticosteroid did take down the pain and inflammation for that moment, but the lasting effects of it caused more damage, which is why there are only a certain amount of corticosteroid injections that the medical doctors will do, because it wears the joint out and wears the bone out, and you can lead to other things like tearing your ligaments. That's how much it dries it out. So they limit it to 3 per year because they don't want you to tear a ligament. Think about that. Think about that. Very, very serious. Sometimes when you take drugs like that, the temporary benefit is not outweighing the long-term deficit that it does. A lot of times people are in pain, they want to get out of pain, they don't care, which is fine for that moment. But a year later, 2 years later, they significantly care because now they're in significantly more pain. Just think about it. Okay, next thing that they can do is hyaluronic acids, which can provide some pain relief and improve function, and over-the-counter topical creams to help with that pain. Physical therapy and OT are very good therapy. Getting on a light exercise program to get the joints moving and flexible to reduce pain is always a good idea. Techniques typically to move the joints through their full range of motion is what we're going to be looking for that. Lifestyle modifications, weight management is always critical, and keeping that exercise regularly is important. And if you need to use braces, absolutely. If things get stiff and painful, you can typically manage it also through hot and cold therapies. Surgery, if you have loose fragments and your surfaces are really rough, medical facilities can do arthroscopic knee surgery to take away some of those loose fragments. If the bone are really, really bad, then you can look at joint replacements. Okay. Next condition we're going to talk about is rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disorder that primarily affects the joints, but it could also affect systemic issues as well, impacting various organs throughout the body. RA occurs when the immune system mistakenly attacks the synovium, the lining of the membrane that surrounds the joint. What causes it? There is no exact cause of rheumatoid arthritis. There are several factors believed to contribute to its development, including genetics, family history. If somebody in your family has it, there's a chance you can get it. Autoimmune factors, the immune system's malfunction leads to inflammation and joint damage. Environmental factors, exposure to certain toxins, smoking and infections may trigger or exacerbate the condition. Hormone factors, hormonal changes such as those during pregnancy or menopause may influence the development of RA. What are some of the symptoms of rheumatoid arthritis? Some of the symptoms can vary in severity and may come and go often, persistent with periods of flare-up and remission. A lot of times you're going to have joint pain and swelling, often in the small joints of the hands and feet. A lot of times you're going to have morning stiffness lasting for more than an hour. You're going to have warm and red joints. They're going to feel hot and red. You're going to have typically fatigue, general feeling of tiredness and lack of energy. You can have a low-grade fever, and if you have symptoms affecting both sides, it could be, systemic. Diagnosis. We're going to diagnose this through medical history, physical exam. We're going to review our symptoms and look for the pattern and the joints involved and the family history. We're going to do blood work. We can get a rheumatoid factor. We can get an anti-CCP blood test. So both of those are blood tests. We can get an ESR and a C-reactive protein to gauge your inflammation levels. Imaging, obviously, we're going to want to check for x-rays to check for joint damage, ultrasound and MRI to assess joint inflammation and damage. Treatment. While there is no cure for RA, treatment can help manage the symptoms to prevent joint damage. Treatment plans typically include medication, lifestyle changes, and possible surgery. So some of the medications include non-steroidal anti-inflammatory to decrease pain, corticosteroids, which helps take away pain. If you didn't hear me, go back 5 minutes ago, listen to what I said about corticosteroids. DMARDs, which is disease-modifying anti-rheumatic drugs. They are such as methotrexate. They're meant to slow the disease progression down and try to save the joints from permanent damage. There's some new drugs out there. Biologic agents, which are meant to target specific parts of the immune system to inhibit those areas that are causing the inflammation and structural damage. There's another new class, Janus kinase. It's called JAK inhibitors. It's a newer class of medication to manage RA. Conservative therapy, physical and occupational therapy, typically to help and strengthen the muscles around the joints, improve flexibility and function. Developing strategies to perform your daily activities better. So lifestyle modifications are going to be important. Regular exercise, swimming, cycling, maintaining a healthy weight to reduce stress on the joints. And again, hot and cold therapies And while surgery is not typical with RA, in some severe cases, surgery can be an option to replace joints if the destruction has gotten so bad. The next arthritis that we're going to talk about is gout. Don't forget, I covered these last three in depth in my previous episodes. All right, so gout is an inflammatory arthritis that occurs when high levels of uric acid are in the blood, forming urate crystals around the joints. These crystals can cause severe pain. They can also cause redness, warmth, swelling, most times in the big toe, but they can affect other joints. Gout is primarily caused by hyperuremia, again, where there's too much uric acid in the blood. Factors that can contribute to this increased urea can be diet, high intakes of purine-rich foods such as red meats and shellfish, alcoholic beverages like beer and sugary drinks. Genetics can play a role, family history. Medical conditions such as obesity, hypertension, diabetes, metabolic syndrome, and kidney disease can increase your risk. Medications are used to help it, such as low-dose aspirin, diuretics. Other factors that we want to talk about are symptoms. Gout symptoms often come on suddenly and can include intense joint pain, mostly in the big toe, but can also affect the knees, ankles, wrists, and fingers. The weight of a bed sheet can be significant amount of pain for patients. Not the blanket, the sheet, the thin sheet. You can also have lingering discomfort, which can last from a few days to a few weeks. The inflammation and the redness of the affected joint can be severe, and which is going to then therefore limit your range of motion because of the pain and swelling. How do we diagnose it? Again, a great medical history, good physical exam, and understanding all the symptoms that occur with it. Blood tests to measure uric acid, joint fluid tests to detect urate crystals, x-rays to rule out other causes of joint inflammations, ultrasound to detect urate crystals and inflammation, dual energy CT to identify urate deposits. Treatment. Typically acute, you're going to look at NSAIDs for reducing pain and inflammation. There's going to be several other medicines that are out there. They include corticosteroids and a few other ones. Long-term management of gout is urate lowering therapy, medications. There's a few in the lists. Lifestyle modifications, maintaining a healthy diet with weight, limiting your alcohol level, staying plenty hydrated are key to managing your condition for gout. Okay, now we're going to talk about other conditions. Other conditions we're going to talk about are going to start with bursitis. Bursitis is inflammation of the bursa, which are small fluid-filled sacs that cushion bones, tendons, and ligaments near your joints. The inflammation can cause pain and limited movements in the affected area. Just a quick side note, bursitis. Anytime you see the word itis on the end of a word, that itself means inflammation. So burs, B-U-R, B-U-R-S is going to be considered the bursa. So inflammation of the bursa. Very simple, just a little side note, FYI. Anytime you see the word itis, it's going to be inflammation of that area. So bursitis is inflammation of the bursa. Okay, so bursitis is usually caused by repetitive motion or prolonged pressure on a joint, but it can also be triggered by injury and trauma to a joint. Inflammatory conditions like rheumatoid arthritis, infection like a septic bursa, gout, overuse of a joint. Common locations. While bursitis can occur in any joint, it's most common in the shoulder, subacromial bursitis, elbow, olecranon bursitis, hip, trochanteric bursitis, knee, prepatellar bursitis, heel, retrocalcaneal bursitis, and at the base of the big toe. Symptoms: pain in the affected joint, especially with movement or pressure, swelling or tenderness, red and hot, so red and warm, especially if there's an infection, limited range of motion. How are we going to diagnose this? Okay, we're going to diagnose it. Good medical history, good physical exam, imaging such as x-rays, ultrasound, or MRI to assess the inflammation and rule out other conditions. Aspirations of the bursa fluid for lab analysis to check for infection or gout is possible. Treatment: conservative therapy. Rest, avoid activities that exacerbate the condition. If it hurts, don't do it. Apply ice to reduce pain and inflammation. Compression bandage to support the joint. So the more you lock in that joint, you'll get some compression and make it feel better. When you get home, you want to elevate your leg to get the fluid up so you can get the fluid to come out. So especially if it's in your knees, you're going to elevate, let the fluid come down. NSAIDs for pain. Medical procedures that people can do is aspirations to drain the excessive fluid from the bursa, corticosteroids. Surgical treatments rarely needed, but surgery may be considered if the bursitis frequently or does not respond to other treatments. Surgical treatments can include removal of the inflamed bursa. How do we prevent this? Avoid repetitive motions and prolonged pressure on the joints. Use cushioning material or pads when kneeling or leaning on the elbows. Maintain good posture or ergonomic tools to warm up. Use good posture and ergonomic tools. Warm up and stretch before activities. Gradually increase the intensity of the exercises to avoid stress. If you ever seen somebody with an elbow bursitis, it's going to be a little sac that hangs off the end, and it definitely takes time to go down. Okay, next condition that we're going to talk about is patellar tendonitis. So patellar tendonitis is also known as jumper's knee. It is a common overuse injury that results in inflammation of the patella tendon. So the patella tendon connects the kneecap, the patella, to the shin bone, the tibia. And this helps to extend the knee. What causes patellar tendonitis? Usually caused by repetitive stresses, commonly seen in activities that involve a lot of jumping and running. It's prevalent among athletes such as basketball, volleyball, track and field. What are some of the symptoms? Pain and tenderness at the base of the kneecap, swelling in the area, pain that worsens with physical activity. You could have stiffness in the knee, especially after periods of inactivity, and difficulty fully extending the knee. We're going to diagnose this by a great physical exam, check for tenderness and swelling, imaging such as x-rays to rule out other conditions, and you could also do MRI or ultrasound to assess the level of inflammation. Treatment: typically conservative treatment, rest, and avoid activities that make it worse. It hurts, don't do it. You could apply ice to decrease pain and inflammation. Again, compression bandages and knee supports to take pressure off. Elevate that leg, get the fluid down, do some physical therapy to help with focus strengthening and stretching of the quads, hamstrings, and calf. Medically, they're going to want to do some NSAIDs and corticosteroids. You could also do PRP therapy, platelet-rich plasma injections. You could do shock wave therapy extracorporeal shockwave to stimulate tendon healing. In rare cases, surgery might be an option to repair the tendon damage. So typically you want to prevent this, regularly perform exercise to strengthen and exercises the muscle around the joint, properly stretch before your activities, and gradually increasing the intensity and training regimens to avoid stress on the knee. Wearing appropriate footwear to reduce impact of the knees as well. Okay, next one on the list that we're going to talk about is a Baker's cyst, also known as a popliteal cyst. It is a fluid-filled cyst that develops behind the knee. It's usually the result of excess synovial fluid. This is the fluid that lubricates inside the knee, and it's being pushed into the bursa. Bursa, we just talked about, the sac behind the knee. This condition can cause discomfort and decreased motion, but is generally considered not serious. What causes it? Typically, excessive synovial fluid from conditions such as OA, RA, meniscal tears, knee injuries, trauma, and inflammatory condition. Symptoms: swelling behind the knee, a feeling of tightness or fullness behind the knee with pain, especially when the knee is extended. Stiffness and decreased ranges of motion are also there. Sometimes there is no symptoms and the cyst is just there. You just found it. So a side note, I actually had one of these when I had my unhappy triangle. So I had an unhappy triangle tear. And I also had a bonus of a pretty large Baker's cyst. So sometimes when you pop your or tear your ligaments, you're going to have that cyst form behind the knee. And it could be rather annoying, especially when you walk. And the more you walk, the more it fills up. So you really got to rest it. How are we going to diagnose it? Physical examination, ultrasound, and MRI to confirm the presence of the cyst to assess the underlying joint issues. X-rays can be used to identify arthritis or other bone abnormalities. Conservative care, rest, avoid activities that make it worse. Again, apply ice, compressions, elevate. Physical therapy to strengthen the area. You could use NSAIDs for pain and inflammation. Medically, they're going to do aspirations using a needle to pull the fluid out of the knee. Again, corticosteroids is an option. Rarely is surgery needed. Surgery may be considered if there's significant pain or complications, but it rarely occurs. So typically managing this condition, you want to really avoid activities that stretch the joint out. Next condition that we're going to talk about is Osteoarthritis. Osteoarthritis is a common knee pain in growing adolescents. It is an inflammation just below the knee where the tendon from the kneecap, the patellar tendon, attaches to the shin bone, the tibia. This condition often occurs with growth spurts when bones and muscles and tendons and structures are changing rapidly. So what causes it? Typically repetitive stresses on the patellar tendon, rapid growth, involvement in sports that require running and jumping and position changes quick, like basketball, gymnastics, football, ballet. What are the symptoms? Pain, swelling, tenderness at the tibial tuberosity. So that's the bony bumps on your shin bone just below the kneecap. Increased pain with activities such as running and jumping or climbing stairs. Typically get relief with pain. You get relief of pain with rest. And the visual bumps may develop at the tibial tuberosity. We're going to diagnose this with a good medical history and physical exam. X-rays may be performed to rule out other conditions. Conservative care, we're going to rest, reduce the activity. So we're going to stop whatever activity we're going to do. Again, apply ice, compressions. We have non-steroidal, non-NSAIDs, stretching and strengthening exercises for quads, hamstrings, and other leg muscles. Surgery is really very rarely required and only considered if symptoms are severe and they don't respond to other treatments. Prognosis is very good for this condition. It usually resolves when the child stops growing. Next condition that we're going to talk about is plica. Plica syndrome is a condition that arises when a plica, a fold of the synovial membrane in the knee joint, becomes irritated, inflamed, or thickened. While plica are normal anatomical structures in the knee, they can cause problems if they are subjected to repetitive stresses or injury. So typically causes are repetitive knee injury, movements or excessive activities or trauma or overuse in sports or physical activities. Symptoms, pain in the knee, typically in the front of the knee or the inside middle part of the knee, with swelling and fullness, a clicking or snapping sensation during knee movement. With stiffness, the pain usually worsens with activities such as squatting and climbing stairs. We're going to diagnose this with a good physical exam, good medical history, and imaging such as an MRI to rule out other conditions. Arthroscopy may be used for both diagnosis and treatment of this condition. Conservative treatment, rest, avoid activities that make it worse, ice, NSAIDs, compression, physical therapy to strengthen the areas around it, surgery, treatments. If conservative measurements fail, arthroscopic surgery might be considered. Prevention, avoid repetitive motions and proper warm-up and stretching. So as you can see, there are a lot of conditions in the knee. It's very, very involved. It is critical you get to your healthcare provider so they can do a full analysis of your condition. If you have any one of these conditions, please see one of your providers. If you're in the area of me, come to the office. We'll be happy to take a look at you and see if we can help you. As always, the opinions you heard here are my opinions and my opinions alone. They are not medical advice. With that said, next episode, I'm going to take a little bit of a deeper dive into the therapies and treatments for the knee. So as I always say, the foundation of you is critical for what you can do and can't do. If your knee function is bad, you can't stand, sit, walk, run. It's the first step, right? Start with your ankles, then goes to your knees, knee joints connect the hip joint and yada, yada, yada. You heard that when you were a kid. That is all true. Your knees play a significant role. Take care of them. Don't let it get bad. You know what? I'm going to tell you a 30-second story. I was at a convention this past weekend and I saw somebody. I went to the gym in the morning. I saw somebody there and I was telling him, you should go see somebody. I see the way your knees are. I see the way you're walking. His knees were bent in. That's a condition. He's like, no, I was going over some of the different options out there. He's like, no, it's really not that bad. I'm going to wait till it gets worse. I was like, okay, good luck, best wishes. I'm saying to myself, this person's going to wait until the knees get progressively worse, until you have no options. Don't be that person. Don't wait. The earlier you treat your knees, the more you have to work with. The further your disease or condition gets, the harder it is to treat. Be smart. You only got one of these, one body, that's it. There's no Sam's Club, Walmart, Costco to replacement. You can't get it done. Replacements come with a whole nother problem that we can get into another time. But your health matters, your knees matter. You get one shot at this thing. Take advantage of it. Do the best you can because health matters. Be well. Till next time. If you know anybody that this can help, please subscribe. Please send this to a friend, family member. You might just help them take control of their life again. Be well.